Parker Schumacher. Schumacher. Mocker?
Mocker, yeah.
Mocker. Is a registered dietitian. Boy, look at the list of initials behind this cat's name. MSRDEPEIEIO. What is that? Clinical dietitian with Astria Health. And we love Astria around here. We talk about you guys all the time. And now I'm loving the fact that we're going to actually talk to some of the people who are hands-on in the biz. We talked to a surgeon last time around, and now we've got a dietitian. We're bombarded by dietary information all the time. You actually work with meals inside the hospitals? Is that how that works? Are you an in-house sort of guy?
Yes, sir.
So if I'm in room 106 and I'm not doing well and I need a specialty diet, that's on you.
Yes, sir.
All right. So in the grand scheme of health, where do you think the nutritionary part comes into play in terms of recovery and coming back into good health?
With any sort of disease and any sort of traumatic event that happens, recovery is the primary thing that everybody's concerned with. Various increases in inflammation, various just disease states. Some people need more protein. Some people need more water in their diet. Some people need less sodium.
So do you get to determine that, or do the docs determine that, and then you create the foodstuffs based on, it's almost like a prescription from the doc. This guy needs X number of grams of protein, whatever, and then you knock it out. Is that how that works?
Yeah, the doctor kind of acts like a little bit of a quarterback. So they make the calls, and then from those calls, I then create the diet plan for the patients.
So you're the running back.
Sure, I love it.
He hands you the slip, and you burst through the line of vegetables, and there you are. Head to the end zone covered in bacon. I don't know. I know one of the things that we're...
What?
Why not?
What?
Why not? Maybe not if you're battling cancer. You guys have a kind of a partnership with the Fred Hutch Cancer Center, and so those guys are cutting edge and all, and you guys are in lockstep with them. So just out of curiosity, since cancer affects so many people, what are specialty dietary concerns if cancer's a diagnosis that you're dealing with, or does it vary on it whether it's different kinds of cancer, or is there a generic? Because I often heard that, like, what is it, sugar feeds cancer or something, some goofy stuff like that. What can you tell us, Parker, to set ourselves straight on all of that?
I think you hit the nail on the head with different forms of cancer do have different dietary restrictions and allowances. There are many bits of information out there, like sugar feeds cancer, wanting to make sure that you have enough water, that sort of thing.
Yeah.
For example, any sort of colon cancer, that sort of thing, you may deal with a lot of constipation and diarrhea. So making sure your fiber is on point is very important. However, on the flip side, melanoma, you're probably not necessarily going to deal with a whole lot of constipation or diarrhea with a skin cancer of that sort.
Right.
Interesting.
I'm distracted by basically, like, we have so much national notoriety on our chefs, all these cooking shows, and they become celebrities. It's like you're a celebrity chef that nobody knows because you're in a hospital and your audience isn't broadcast on TV. They're actually in patient rooms, and you're behind the scenes cooking up better health for them. So I'm just saying, I think it's a really cool gig, and I'm so glad that there's a specialist to do that. And way to go, Astria, for making this part of what we need to know about. This a support group. Tell us about like what to eat, cooking through cancer. There's a group coming up in March for people at home who are like recovering at home, and that they should adjust their diets, that sort of thing. Is that
all people are invited? So it's current cancer patients, survivors, family of, everybody's invited to come. We had our first one earlier here in February, kind of talking about how to eat, as like, how do you manage your different systems or different symptoms? How do you manage different treatment side effects, that sort of thing. And this next one that's coming up is focusing on the what sorts of foods to focus on, what sorts of meals to create for yourself in order to kind of manage your symptoms before and after treatment, because it is different.
Brian, if you're like really good at gardening, they say you have a green thumb.
Mm-hmm.
So if you're a good cook through all this, we have like a gravy thumb. What do they call it in the world of nutritional health? Is there a term for what you guys are?
A golden thumb, maybe.
Golden thumb, maybe.
Let's, if there isn't a designation already, let's create one, shall we?
Sure.
Let's just say the golden thumb.
The golden thumb. I'll run with it. Absolutely.
All right. Coming up on Tuesday, though, March the 17th at 3:30, the Fred Hutch Office of Community Outreach and Engagement down in Sunnyside, 320 North 16th. I imagine we could find that on a website somewhere
Yes, sir.
that would have all this information. Open, as you've said, Parker, to patients, families, anybody. Spanish interpretation available as well, which I think is something great.
You know, on ongoing nutritional, with consciousness, if you will, is also great at, wouldn't you say, preventing disease, certain disease, whether it's cancer, whether it's diabetes, those kinds of things. Our colleague here, Lance Tormey, who's been informing Yakima Valley on news for about 38 years. One of the things he does that leads by example and kind of inspires, he's a very healthy eater. And he'll have snacks, he'll have fresh fruits, vegetables, those kinds of things. How important is messaging to explaining to people that you really kind of take matters before you have something that you need to battle with nutrition, right?
Absolutely. And like Dr. Williams said on your show earlier, nutrition is everything. And I mean, I'm a little bit biased, obviously.
Yeah. Yes, you are.
We'll just take sodium, for example. Any sort of excess sodium intake, you end up with hypertension, which can cause increased risk for heart disease, diabetes, or diabetes, but kidney disease, that sort of thing. And so really good quality nutrition early on in life prevents diseases, mitigates most of those comorbidities, and reduces potentials for issues.
Yeah, sure does.
So find out more about it, especially on the cancer side of things, with information workshops like coming up on Tuesday, March 17th. I never thought about like food dyes. We're hearing conversations about that now nationally, that we should make your Cheetos clear, not yellow because of the dye or whatever, those kinds of conversations. But to be aware of food dyes and the different processing that goes into the foods that we eat. I suppose in a perfect world, it'd all be, farm to plate and fresh and crispy and good, right?
Oh, if I could do farm to plate, I think that would be exceptional for everybody.
Wouldn't Astria carve you out a little garden down there that you could be?
Unfortunately, I don't think in the middle of Sunnyside they'd let us zone for that.
Well, it's like then all the patients that were mobile could get out there and hoe some weeds. And that might help in their recovery that way. You never know. You got to think outside the box. Well, look, again, we're talking with Parker Schumacher here, and he is a clinical registered dietitian with Astria Health, and it's nice to know with all the clinics that they have and all the things that they do. Another one is with this kind of attention to detail and healthy information and cooking within the hospital facilities, but sharing that information with the community as well through these kind of workshops is a really good deal. And you seem to have a very affable personality. I think you'd be a great guy to conduct a seminar, and folks can learn a lot and make their recovery better and perhaps more expedited by adding a good, healthy, nutritional component to the recovery, huh?
Yes, sir. My goal is if I can provide people with a few more months, just a little bit more time of good, healthy, quality life. They can go to a wedding, go to a birthday, do something like that.
Don't miss a graduation.
Miss a graduation. Absolutely, yeah.
Don't miss a graduation. Parker, anything else you want to add? Last word's yours, buddy.
Last word's mine. Eat less, move more, everything in moderation, and half your plate should be vegetables, and then the rest should be lean protein, and if you want a fruit here or there.
Which means he is my... What's the word I'm looking for? Enemy. Yeah, that's what I'm looking for. The enemy of my plate is the friend of yours.
Yeah. But, steering away from the processed things, isn't that just a big thing, though? It really needs to be real food, right?
Real food.
Yeah.
And it gets a little nuancy with processed. Technically, after you cut a piece of meat, it is now processed. But really, the big locations are excess preservatives, excess nitrates, your salamis and that sort of thing are really going to be the thing that kind of increases your risk of different forms of cancer.
But a nice big, when I see some pepperoni on a pizza, I think we've actually talked about this, that it kind of curls up a little bit because of the heat, and there's a little bit of oil in there that pools. Why is that so good? Why
it should actually?
Why can't that taste
it should
bad?
Curl up into a skull and crossbone is what it should do, right? Look, and we had breaking news tonight. This morning. Parker says it's okay to eat with your hands because the minute you cut it, You've processed it.
Okay.
So I think that's a recommendation to just pick it up and gnaw on it right there.
Baby steps, right?
Find out more about all this kind of stuff and more. Just great information. Astria.health. And talk to the pros and the experts at Astria. And I'm just delighted we're getting some FaceTime with you guys because it makes it just that much more real. And we see the expertise that Astria's put together and the friendly, informative nature of the people that work there. Awesome. So thank you so much, man. We appreciate coming in.
Yeah.
Thank you guys for having me.
So cool. Astria.health.